I'm Yvonne Commodore-Mensah, Associate Professor at Johns Hopkins School of Nursing and Public Health with expertise in hypertension research.
My name is Dr. Jennifer Cluett. I am a practicing primary care physician and a hypertension specialist in Boston, Massachusetts. I'm an assistant professor of medicine at Harvard Medical School, and I'm the medical director of our multi-specialty hypertension center here at Beth Israel Deaconess Medical Center.
So why are we having a conversation about home blood pressure monitoring? First, we must acknowledge that we have a hypertension problem in the United States. 1 in 2 adults has hypertension, and only 1 in 5 adults who have hypertension has the condition under control. We know that hypertension or high blood pressure is a major risk factor for cardiovascular disease, stroke, kidney disease, and vascular dementia. We also know that hypertensive disorders of pregnancy are increasing, and we know that this also increases a woman's lifetime risk of cardiovascular disease. We also know that there are persistent racial and ethnic disparities in hypertension prevalence and control. For instance, Black people are more likely to be diagnosed with hypertension and less likely to have their condition under control. The good news is that there are proven best practices and evidence-based interventions to improve blood pressure. And one of those strategies is home blood pressure monitoring or self-measured blood pressure monitoring. Home blood pressure monitoring involves a patient's use of a personal monitoring device to assess and record their blood pressure at home.
The United States Preventive Services Task Force, going back to around 2015, has recommended using out-of-office blood pressure measurements to confirm the diagnosis and before starting treatment. So our options for out-of-office blood pressure measurement include 24-hour ambulatory blood pressure monitoring, which has long been considered the gold standard. And although I'm a fan of ABPM, it really is just a snapshot of a patient's hypertension journey. And what I really love about whole blood pressure monitoring is that it's something that patients can do on their own, in their own home, over weeks or even over years. And it can really give them a sense of engagement and participation, as well as an immediate feedback mechanism on their health. But I think just giving a whole blood pressure patient a cuff alone is not really enough. You have to combine that along with some clinical support, medication titration, education, lifestyle counseling. And that support can be done by nurses, by pharmacists, by physicians or other clinicians. But all of that together has been what is shown to improve hypertension. It's important to note that this combination of factors, home blood pressure plus a co-intervention or support for the patients at home, has been shown to not just improve their hypertension care immediately, but even long-term and sustained for a year and beyond.